My name is Chandan, and I am going to walk you through the basic flow of our application. So this is the dashboard that you get after login. Over here, you can see that we have a pool panel which shows the current time, the current weather report, and the live queue patient, which is scrolling. So the user can directly access and have a look around the hospital queue. They can click on any patient, and the vitals will be shown to the user. And a summarized report for this patient is presented over here by Savi, our intelligent agent. Next, we have a meter which shows how many patients are there in the queue, how many are in the waiting, and the beds which is available in the hospital right now, and doctor's status. Over here, we have the waiting room where the live status of the room is being shown. So, for instance, in the general ward, 1013 patient is waiting, and their treatment has not been started yet. We can click over it, and the user can do some actions from here only. They can start the treatment, they can notify care team. Over here, we have our Savi, the intelligent agentic system we have built. These are the prompt ideas that you can give to Savi, and Savi will act on behalf of us. So for an instance, let's say we want to check which patient need attention first. So I'll click on it. So in less than 5 seconds, the Savi has generated a report for us. So as you can see, one critical patient is waiting, and they need attention. Also, she is asking if I can just tell her to start the treatment right now. So now you can see that the patient has moved from the waiting room, and the treatment of that patient has been started. So here I have prefilled patient details, and I will just let the Savi generate a quick summary. So as you can see, based on these values I have filled, Savi has generated a quick summary about this patient. And so now I will click on save and take, and the workflow has started. So the first step was intaking. So this has been received and saved into the database. So the patient with 1014 having high fever and body pain, it goes into our intelligent agent Savi. Then the first agent, which is Triage, it's now working, and it's deciding the level of urgency for this patient. So it has suggested a critical 95 score for this patient, and these are the possibilities this patient can have. You can click on this option to see how this was decided. So as you can see, this is a summarized report, how this score was given to this patient. Now the researcher agent, which is our second agent, is going online and searching for articles based on whatever symptoms we have given to this patient. So as currently I'm in Delhi, so in Delhi, it is searching for media news reports about whatever diseases and whatever currently going on in the local region. So as you can see, the medical research agent went online. So now you can see that research has been finished, and this went to the briefing and citation. So whatever research report has been generated, it will be accurately cited into our system. So later, this report can be retrieved. So now you can see that the patient has been placed into critical. Why? Here is the reason. And at last, the assignment agent has done its work and assigned Dr. Sanjay Gupta. Here is the reason how doctor was assigned. At the last, the care team has been notified. Care team consists of the doctor who is treating the patient, the general intake desk, and the nurses. The workflow has been completed and the patient is put in critical. Now, if we go to the queue, you can see that this patient is waiting on the queue, and this patient is in the critical section. You can see that this patient is waiting in the queue. So here you can see that our patient is currently waiting now, and it's awaiting for a response from Dr. Sanjay. So now I have logged into the system as Dr. Sanjay Gupta, and here you can see that I have a notification that this patient 1014 is waiting for us. Also in the waiting room, we can see that this patient is waiting. I can click on this patient. I can start the treatment from here. And you can see that this patient has now moved into the treatment. Now the treatment is done, and now Dr. Sanjay Gupta can discharge this patient.
Hi, this is Vijeta from 8-bit team. I will be explaining further. So So here you can see in the dashboard, in the last 30 days our AI agents processed 40 records, saved nearly 20 hours of the time, and achieved 100% research coverage. The dashboard provides the real-time insights to the patient through a good urgency distribution, and here you can see that it is divided by the departments, and the balanced doctor workload helping us. It allows the system to continuously incorporate the latest medical guidelines, hospital policies, treatment protocols, and internal documentation without requiring changes to the application logic. This ensures that all the AI agents work with accurate and up-to-date information, resulting in a more reliable response, better clinical decision support, reduced maintenance effort, and faster adaptation to new medical knowledge. The entire treatment pipeline, it tracks queue load, critical patients, wait time, and the urgency trends in real time. Our AI agents automatically prioritize the case to the best doctor, notify care teams, and perform medical research. The observability panel measures every step, ensuring faster, triaged, balanced workloads and transparent and data driven healthcare operations.